In the name of Allah, the most merciful and beneficent. Hello and Assalamu alaikum. I'm Hira Iftikhar and I will be your presenter today. I'm lecturer of food and nutrition at University of Agriculture, Faisalabad, Pakistan. My research interests include public health nutrition, malnutrition, sensory evaluation of foods, product development, meal management practices, and culinary arts. I'm also a PhD scholar at University of Agriculture, Faisalabad, in the subject of human nutrition and dietetics. The topic we are going to discuss today is digital healthcare and immunology. I feel very privileged to be a part of this international conference on modern medicine and global health 2023. Talking about digital healthcare is a broad multidisciplinary concept that includes concept from an intersection between technology and healthcare. Digital health applies digital transformation to the healthcare field, incorporating software, hardware, and services. Under its umbrella, digital health includes mobile health apps, electronic health records, electronic medical records, wearable devices, telehealth, and telemedicine, as well as it includes personalized medicine. Nowadays, it is very important to know about digital health. It has various aspects like consumer wearables, connected biometric sensors, smartphone cameras, clinical trials for patient information and collection tools, in-home connected virtual assistants, telemedicine and virtual physician visits, personal health records, web-based interactive programs, text messaging or emails, health system disease management apps, consumer mobile apps. These are all tools which are one way or another included in our daily life in this e-technology world. Now talking about digital healthcare and immunology. In recent past, digital healthcare technologies are experiencing a significant leap in development with an additional unforeseen acceleration in the implementation because of COVID pandemic. The increased use of mobile application as well as communication technologies to search for services and support hold particular advantages for the management of chronic diseases requiring medium to long-term treatments and regular follow-up visits. That's why it is very helpful in immunology through digital healthcare system to get follow-up of patients. As an example, we will talk about allergen immunotherapy or AIT. Allergen immunotherapy requiring regular application of treatments represent an optimal scenario for feasible digital support. From patient satisfaction and care pathways over personalized decisions support from complex clinical scenarios towards a close, flexible patient-doctor communication is all blended in care system. Digital decisions support for early identification of patients who can be benefit from AIT. Between the first onset of potential allergy symptoms and a proper diagnostic workup, there may be a gap of several years. As underdiagnosed and undertreated allergic rhinitis not only represents a significant burden with regard to quality of life, but also in terms of economic impact. So it is desirable to improve the access of patients with symptoms to a proper diagnostic workup. Possible solutions can be broadly available symptom assessment applications, digital diaries, indicating a potential correlation between symptoms and exposure, as well as clinical decision support system for primary care doctor and specialists. E-health for AIT can have following four aspects: diagnosis and prescriptions. It can have all the information about in vivo, in vitro symptoms of patient, and after that, what type of care service should be given to the patient, personalized visits, e-consults, e-prescriptions, database cares. Then adherence support system is also a part of e-health, which includes remote follow-up, reminders, e-prescriptions, and exposures. All that helps for the early patient satisfaction because patient will get all this information at their home on their applications or any of e-technology tools. The importance of digital healthcare in AIT conditions. The widespread availability of technology-based interventions for the clinical setting has important implications for allergy or immunology providers. Education and self-management interventions for asthma and allergic reactions enable patients to play an active role in their medical care. Patients facing mobile health or M-health technologies, for example, those who are using smartphones or tablet-based applications, have a variety of features that include medical reminders, educational content, games, their symptom diaries, electronic sensors, and or patient self-tracking dashboards, which help patients to track their symptoms and their health records. Other emerging features include voice recognition, wearable technology, pollen and pollutant sensors, and virtual reality that will help in early detection of symptoms of allergy. Many of the successful applications are multifunctional and evidence-based. Along these lines, mobile health interventions have been shown to favorably impact clinical, economic, and process outcomes. Specifically, these interventions have been linked to improve inpatient knowledge and medication adherence, improvement in asthma control and quality of life, and fewer unscheduled office visits. Mobile health technologies continue to rapidly evolve and have great potential to improve patient centered outcomes and provide workflow in real time. Smartphone and tablet based mobile applications have a great effect on distinct types of interventions, encouraging patients for self management. M-health interventions can help with adherence support and trigger identification and avoidance. Apps may deliver guideline-based education, increase patients' engagement, and optimize patient-provider communication. In this regard, wearables are also very helpful. Wearable technologies help to sense environmental triggers or provide information regarding symptoms. Wearables often connect to the internet or pair with mobile devices. Many wearables have sensors to detect signal from the patient's body and assist with treatment modification. These devices silently collect data, especially clinical data, through non-invasive techniques. That's why it is very safe and have been evaluated among adolescents and other adults to track patients' outcome. Another impact of digital healthcare is building digital twins of the human immune system. It is a very interesting aspect of digital health for future studies. Digital twins are the captured key features of the immune system with its obsequious influence in human disease. Being able to predict an individual's immune response to infection or injury could be life-saving in many ways. For instance, in designing optimal individualized treatments for personalized healthcare. The construction and use of a digital twin. The construction and use of a digital twin in which each relevant physiological scale known biology and relevant mechanism are characterized through data collection that informs one or more computational models. The models are at the individual scale are then integrated into a comprehensive multi-scale base model. In the second step, this base model is personalized by parameterizing it with the data collected from an individual patient. The resulting digital twin can then be used for clinical decision making for this patient. Concluding our topic, I would like to say that digital technologies offer a broad spectrum of possibilities to improve the management of immune system diseases, starting with the identification of patients who could benefit from this disease-modifying treatment over database personalized decision, support for complex clinical scenarios to close yet flexible patient-doctor communication, In blended care settings, the opportunities are manifold. The current COVID-19 pandemic illustrated how efficiently digital technologies support optimal care of patients in the scenario and fostered further innovative development in this field. However, more studies are needed to prove the positive impact of individual technologies and on patient satisfaction, diagnostic workups, prescription adherence, and above all, clinical outcomes. That would be all from my side. Thank you very much for listening. Have a nice day. Goodbye and Allah Hafiz.